Welcome to part 2 of the Introduction to Risk Assessment course. This is GCU from the University of Minnesota. And in this part of the module, we will be focusing on hazard identification, which is the first step in the risk assessment process. Hazard identification is the process of determining whether exposure to a chemical can cause an increase in the incidence of a specific adverse health effect. The goal of this step is not to assess how likely harm is to occur at a certain exposure level, but rather to understand the inherent ability of a substance to cause harm. Some key questions we ask include: what type of toxicity is observed? Which organs or systems are affected? Is the effect acute or chronic? And is the effect reversible or irreversible? To identify hazards, we rely on a variety of data sources. These include human studies such as epidemiology and case reports, animal studies like chronic toxicity tests, in vivo studies which are cell-based, in vivo studies conducted on living organisms, and in silico models which use computational predictions. These sources give us a comprehensive picture of a substance's toxicity. We also need to consider how data from non-human sources apply to humans. For example, how do we interpret toxicity tests in rats for human health outcomes? Ideally, human data is preferred. While it's unethical to intentionally expose humans to hazardous chemicals, we can learn from real-world exposures captured in epidemiological studies. Deterministic toxic effects are those that are directly measurable. Deterministic effects include measurable outcomes such as a tissue damage or organ toxicity. These effects often appear soon after exposure and are typically associated with non-carcinogenic chemicals. For example, chemical burns or organ damage that occurs shortly after high exposure would be considered deterministic. Probabilistic toxic effects are long-term effects that are not directly measurable relative to exposure level. These effects require statistical analysis of large populations to determine risk. Cancer is a classic example of a probabilistic effect because it can take years to develop and is influenced by many factors beyond just exposure.
This lesson has been created by the Interdisciplinary Training, Education, and Research Activities for Assessing and Controlling Contaminants from Emerging Technologies program, a collaboration of the University of Minnesota School of Public Health, the University of Iowa College of Public Health, and the University of California, Los Angeles Fielding School of Public Health. Funding for InTERACCT is provided by the National Institute of Environmental Health Sciences of the National Institutes of Health. The content of this lesson is the sole responsibility of the developers and does not necessarily represent the official views of the National Institutes of Health.